$50 million lawsuit filed just today, Tuesday afternoon, by Baldoni against the Times in LA Superior Court. Baldoni is among a group of 10 plaintiffs, actually. That's also including publicists Melissa
Darlings,
Nathan and Jennifer Abel.
we are back for another.
And false light
Hmm,
invasion. It's a false light invasion of privacy.
I want to say
Over
issue
the
that has long
first article
plagued
titled, quote, "We can build
a lot
anything
of
inside a Hollywood
Americans
machine," unquote.
living in the
parties, which also
country,
included
and that
producers
is
James
getting
and Steve Sarowitz, claimed
proper
that
health care,
relied
insurance,
on, quote,
and getting
cherry-picking
approved for
and altered
medications that you really need.
quote unquote,
And
cherry-picked
unfortunately,
and
a lot
altered
of our
stripped of necessary context
American neighbors, even family members, have had the unfortunate
Now, a New York Times spokesperson
incidents
responded
or
by saying,
incidents
quote, "The role
where truly
is to follow the
necessary medication or truly necessary
story
care
and
is
It was based on a review of thousands of pages of
rejected
original documents,
or not approved
including text
by
messages
the carrier, their insurance carriers.
accurately
Now,
laid in the article. To date, Wayfarer Studios
as one who works in the healthcare industry,
and their representatives have not pointed
it's very unsettling for me each time that I hear, like in the hallways, although I'm not in a patient-facing clinical capacity, it's still heartbreaking for me to hear when I hear patients or family members, when they speak to each other in hushed tones, but you still overhear it. Where, for example, somebody might say, how are we going to manage to make the payments for this procedure? Or what would we do if the procedure that, patient XYZ is not approved for? It's heartbreaking. It's heartbreaking. And on the other side of that, as a patient who has gone to visits in the ER or have brought patients to the ER for whatever reason, whatever emergency they were having or I was having, and having to sit there in the waiting room and you're in pain, obvious pain, and then having to try to talk yourself into
intimate harassment allegations to assert
finding a zen, finding your center, finding an idea or a memory that would help you relax, even though obviously in the emergency room it's high octane. It's not a place where you really relax, right? But you try to. But I find myself wondering, what about the people in this emergency room who doesn't actually have insurance, like me? And I feel bad for them. And I always feel bad for them. So with that, an article by The Guardian says that nearly 1 in 4 doctors say that the practice of prior authorization has led to serious issues for patients. And in the wake of the unaliving of Brian Thompson, the CEO of United Healthcare, and the outpouring of frustration about insurance coverage, prior authorizations have emerged as a particular roadblock in healthcare. And I don't mean to say that we are diminishing the unconscionable act against the person of Brian Thompson, the former CEO of United Healthcare, because he is no longer living and he unfortunately met his demise at the hands of, allegedly, Luigi Mangione. But I can also
and intentionally omitting texts
sympathize with people who say that, as the CEO, you have oversight over policies that would take place. Probably not the day-to-day quotidian work and or tasks, but the overarching authority would be yours, and obviously the board of directors or whoever they are, right? In implementing and drafting policies. So there's that part too. You sympathize with a family who obviously is grieving. You also sympathize with people who feel like the healthcare in the United States needs to be reviewed, reassessed. In that, our leaders need to look into truly how we can move forward with less of a need for a lot of the red tape that we have to overcome, all these obstacles that we have to overcome to treat one patient. I mean, imagine the millions that we have in the United States. So, per the article, prior authorization requires medical providers to get insurer's approval before patients receive healthcare or medications. This is true. Quote, as a physician, prior authorization is the number one frustrating thing of practicing outpatient medicine right now, far and away, said Dr. Gabriel Boslett, a pulmonologist and professor at Indiana University School of Medicine. Quote, I spend more time trying to figure out how I need to get this medication approved than I do seeing the patient and making a diagnosis and writing the prescription, unquote. And I have seen this in my earlier years in healthcare, patient-facing clinical departments, where the doctors would be frustrated because the nurses would tell them, doctor, we just received news that, XYZ patient, their insurance won't cover XY procedure or XY medication. Can you please re-review and maybe find out, an equivalent sort of medication that you can prescribe them, or maybe a different treatment altogether. It's frustrating. I realize that. So I can sympathize with patients and their family members and their frustrations. I mean, just hearing that day in, day out, while I was, in a patient-facing clinical department, it really can erode your on your mental health, because you start to feel like this is something that can potentially be an experience for me, right? So back to the report. Originally intended to control the costs of certain medications and treatments, the frequency of prior authorization requirements has risen in recent years, and they now plague common and inexpensive care. Not just in medical health care. This is also common in say, even in the dental sector. When I go to my dentist, they're like, let's see, we have to go and get pre-authorization for this care and that care. And I'm like, but when I sign up for my insurance every year, when I renew, these things are outlined to be something that is common, that I wouldn't have to get prior authorization for. So it just, yeah. It gets frustrating. So anyway, so back to the report. Miranda Yaver, assistant professor of health policy and management at the University of Pittsburgh, noted that, quote, prior authorization is something that really proliferated with the growth of managed care in the United States, unquote. Now, still per the report, one study found reforms such as setting maximum time periods for insurer to respond and standardizing requests would help give patients needed care. I do understand. If I recall correctly, we would sometimes get patients, and they would be insured with a different insurer that has like their own network, right? So because, say for example, in an emergency capacity, you go to the nearest emergency room to you, you do not have the time to be going through your insurance network book to look for the closest emergency room that is within network of the insurance that you have, and or a doctor that's within network that can treat you. Obviously, you're gonna go to the emergency room that is closest to you. So with that, I have seen insurance, they would call wherever the patient is and say, look, the patient is not going to the patient is not going to be able to continue their treatment there because the insurance that they have right now is not going to cover this treatment. They're going to have to be transferred to a another facility, which is within networks, blah blah blah. And that can get very, very difficult and very hairy, especially when the patient is being treated for something that is an immediate, emergent issue. Like, you can't just say, let's unplug, put them in an ambulance, and transfer them to the hospital where the insurance tells us they should be. You treat every patient on a case-by-case basis. So in like emergency capacities, you can't really say that there would be a standard, right, for treating every patient the same. However, there can be a standard, a minimum standard for what you should give the patients, such as care. I'm not saying medications, but like there should be a minimum level of standard of care that you should be able to provide every patient. But to say that there should be, a guidebook on like what is standard for every patient. Every patient is different. Every person is different. So textbooks are more like guidebooks, but they're not like hard. They're not hard. Posts. They're not. It's not like. Well, I would say it's the law, because even laws get amended. I'm just saying. So now, several states apparently, and Washington, D.C. have passed laws to reform prior authorization practices. A federal bill that would expedite authorization like these for Medicare Advantage plans was also reintroduced this year in Congress. In January, the CMS and Centers for Medicare and Medicaid Services finalized a new rule to streamline prior authorizations as a way to cut costs. Nearly one quarter, which is 24% of doctors, say that prior authorization has, quote, led to a serious adverse event for a patient in care, unquote. That could be somebody would like, I don't know, getting denied their medication, even though they already have like multiple infections, which are almost creeping up into life-threatening territory. It's it's just mind-boggling when you're like sitting at the phone waiting for the insurance to call you back and say, okay, you can, we can approve that medication or something. But that could be like hours on end. And in the example that we use, which is like a person who is waiting for their medication to be approved, excuse me, while already battling multiple infections in their bodies, it's literally minutes count. And if you're waiting to be approved for something that they really need, yeah. I really hope that with this tragedy that our leaders become more and more in touch with what is broken in the healthcare industry and how best to make strides to fix this issue, as well as to hopefully always remember that this is a tragedy that could have been prevented. I just feel like there's very little oversight nowadays with big companies that obviously they're for profit, obviously. But I hope that moving forward, we remember to maintain our humanity. However far we get in our chosen careers, I hope that we still maintain a semblance of humanity. And that, taking justice into our own hands against the laws that we have, that, protects you and me and everybody else, is not perfect, but it is there to protect you and me. And again, I understand the frustration. I get frustrated too, but I hope that we can at least pull back and say, this person, even though, their position is different from me, in the end, we're both human and we have families. But I also feel like a lot of things, as again, in the healthcare industry, needs to have better oversight and review. And a whole lot of people, obviously, would be impacted positively if we can, if our leaders can assist in helping unravel where we went wrong with our current healthcare system. Okay, darlings, with that, I shall see you all in the next go around. It is, I don't know, what time is it? It's 8:30. Almost there, darlings. Gonna talk to you later. Until then, remember, you're all kinds of fabulous. That you should always leave grace for others, but don't ignore the red flags. And also, remember to always journey in gratitude. I shall see you all, darling dears, later. To leave for now. Bye.